A lot of times we feel that brushing every day is adequate, but flossing is also very important. Another thing is diet. So a lot of parents would chastise their kids for eating sweets and sugars, but it's not just candy. It's in the juices that you drink, sodas, energy drinks. If you have a lot of coffee and a lot of condensed milk in your coffee, and you have coffee regularly, those things could cause cavities. If you have to have candy, or you have to have sweets, or you have to have soda, combine them with meals. So it's 1/2 an hour period of acidity and not hours on end. The biggest detriment to teeth is having snacks throughout the day. You're trying to combine the snacks and the juice with the meal, so it's one acid attack. Brushing and flossing alone is not enough to prevent decay. The next thing you need to do is to watch your diet. So like we were talking about before, in today's world, with the amount of processed foods that we consume, it's almost impossible to avoid sugar, to avoid sweets, etc. So grouping things together, avoid snacking throughout the day and have meals that pair with snacks. So use the snack as a reward to finishing a meal or something, as opposed to eating it hours or stuff between meals.
In Office with Dr. Jevon Samuels.
Welcome to another episode of In Office. I am Dr. Jevon Samuels. In office with me today is a special guest. Her name is Dr. Rachel Ann Barras. Welcome to the show.
Thanks for having me.
Okay. So In Office is a program which we normally talk about life, sickness and death. And today this episode will be done at Majestic Smile Dentals. They are serious about smiles. And this is where I get my cleaning and my regular dental checkup done. Alright, so you should come and check them out. I'll give her at the end of the session, I'll give her a section to advertise her business as well. Right? So today in office we'll be discussing dental caries and cavities. And my dentist here is an expert in the field, and she will discuss all the intricacies of dental caries and cavities. Alright? So Dr. Barras, alright, I apologize. Dental caries, that's what I want to discuss today. What exactly is dental caries?
So dental caries is actually a breakdown of the tooth structure of the different teeth in your mouth, and it's due to mostly acid.
Okay, acid? Alright, but breakdown of tooth in mouth mainly due to acid, but I know it's for the general public, but could you go into more details? Like I think it related to bacteria as well, and talk about the structure of the teeth, because not everyone will really know about like.
Okay, I'm so happy that you asked. So for starters, people don't think about it like this, but dental caries, cavities, tooth decay, whatever you call it, rotten teeth, they all refer to the same thing, and it's a bacterial infection primarily. There are other ways to get decay without bacteria, but for the most part, it's a bacterial infection. It's actually the most common bacterial infection in the world. Okay. Right? And it's due to the oral environment. So your mouth, my mouth, everybody's mouth has certain bacteria we consider normal, and due to our habits and what we do, the levels of those bacteria could change, and therefore when a bacteria consumes food, same food that we eat, because when we eat we feed ourselves and we nourish our bodies, but we also nourish the bacteria that live in our bodies. And when they pass waste, they pass acid, and that acid damages our teeth. Okay.
Yes, but normally from my medical background, it's gonna probably be a little difficult because I have knowledge in the field as well. Normally you have the saliva. I know that from medicine we know the saliva that is produced in our mouth is normally have carbonates, which normally neutralize the acid. So why does the saliva that we produce don't just neutralize the acid that is there? That's the issue.
I like the way you're thinking. It makes a lot of sense. It's a balance. So that's why sometimes you can see some people with very poor hygiene not have cavities, and people who have somewhat decent hygiene, they brush their teeth every day and they floss and they still get cavities, and they just come to the office frustrated because I do everything I'm supposed to do. Why am I still getting cavities? It's a balance of three things: the bacteria in your mouth, in a substrate that produce acid, and time. So and something to feed the bacteria. So let's say you have okay hygiene, not perfect,
Yes.
but your diet is not filled with processed sugars. You don't eat a lot of sweets, you don't drink a lot of juices and stuff. You may have less cavities than me, who brush my teeth every day, but I snack 5-6 times a day.
Okay.
I love to have a lot of sweets. It will make it overwhelming for the bacteria the saliva, to balance the pH, because it's all about acid.
Okay. All right. Now, for the general public, because I said before, this show is for the general public. So, what are some of the symptoms that someone can would have to indicate that they might have cavities? You know, that early stages, you might not see this big hole in the teeth or the black stuff. But sometimes, because when I go to dentist, when I come here, sometimes they tell me that cavities there, and I'm saying I'm not seeing it. So, what are some of the symptoms that a person might have that indicate that they need to see the dentist?
Okay. So indicators for dental caries is more than a feeling. So you might have a cavity and at first you may not feel any pain. Most of the changes early on are visual. So you may see like parts of your teeth looking frosty white, especially close to the gum line. You may see the creases and crevices of the back teeth looking a little darker. So initially the entire tooth is a shade of white. Some shade of white, not frosty white, like translucent white, like glassy white, but not frosty white. So if you see frosty white changes or darkness in those creases and crevices, that might be a sign that it's time to check your dentist and ask questions about cavities. But a lot of times we may not see any of those signs, and you may still have decay, and you may require a dentist to take x-rays to see the ones between your teeth.
Okay. All right, and so generally you're saying that so now in terms of the feeling that the patient would have, apart from the visual stuff of seeing it, how would they feel? Like I'm not certain if sometimes they say my teeth is sensitive. I came here before to tell something that my teeth is sensitive when I eat like acidic stuff or cold stuff. So the sensitivity, and in the worst case they might have tooth pain.
Pain, swelling. So the second stage, when the decay starts to go a little bit further down, you might start feeling sensitivity. So for example, you can't, if you have ice cream, it's very hard to finish the cone without feeling discomfort. When you drink cold water, you might want to keep it in your cheek first before it touches the other teeth. You know, you might have a hard time having icicle, you don't want anything with ice, you might be avoiding sweet things, it gives you that nedgy feeling. In Jamaica, a lot of patients will say my teeth are cramp me, so cramping of the teeth, sensitive feelings, it's all the same thing. Alright.
Tell the viewers about like the risk factors for developing dental care. What are some of the risk factors that persons might have to develop the caries?
Okay, so poor hygiene is one. A lot of times we feel that brushing every day is adequate, but flossing is also very important. Another thing is diet. So a lot of parents would chastise their kids for eating sweets and sugars, but it's not just candy. It's in the juices that you drink, sodas, energy drinks. If you have a lot of coffee and a lot of condensed milk in your coffee, and you have coffee regularly, those things could cause cavities. Processed food, so even sometimes your cereal, frosted flakes, all those things that we might think are part of a hearty breakfast, they actually could cause decay. Some snacks, like it doesn't have to be always a candy, even like Oreo or different cookies could be sweet too, and it would create food for the bacteria to feed on, and then create an acidic environment in the mouth, which then creates decay.
Alright, but in general in life we have to have a balance. So for example, I have a 2-year-old daughter and she loves candy, you know, so I said, Daddy, she always even let her mom call me on the phone to take candy for her to eat. And I'm saying that I am really concerned about her having like cavities, but at the same time I don't want to tell her that no, don't eat candy, because she's a baby and she loves candy and she wants to eat candy. So what advice did you give me in terms of the amount of candles I can give her, the amount of when we give her, and how often we brush her teeth?
That's fair.
Because I have to give her candy, I know it's wrong, I know it's bad, but to be honest, she's gonna be so sad if she don't get her candy.
Yeah, I understand. I mean, I'm a dentist and I have a sweet tooth. I love candy. It's a hard time for me passing the cashier without picking up something for myself. So what I tell patients is all about balance. One thing that I want to talk about in balance, and it's a bit of a technical thing, but I'm going to try to break it down as simple as possible. When you have a meal, particularly a meal that contains sugar, the bacteria will eat the same time as you, and then as they consume, they produce waste, and for about 30 minutes, your mouth has an acidic environment. You mentioned saliva earlier. The saliva then comes and neutralizes it, so your mouth is no longer acid. That 30-minute period when your mouth is acidic, that's the opportunity for decay. But half an hour only is not enough time to truly cause decay. Now, if after half an hour you had a meal and half an hour later you're driving, then you have a candy, that half an hour turns into an hour. Then after the hour, you reach at your office, you buy a Pepsi, that 1 hour turns into 2 hours, and that is enough time to create decay. So for the question you asked about your daughter, if you have to have candy or you have to have sweets or you have to have soda, combine them with meals. So it's 1 half an hour period of acidity and not hours on end. The biggest detriment to teeth is having snacks throughout the day. You try to combine the snacks and the juice with the meal, so it's 1 acid attack. Other times we feel guilty, we buy the Snickers, we buy the chocolate because we don't want to get cavities, so you might break a piece, then half hour you break another piece, trying to stretch it out throughout the day. When it relates to your teeth, it's better you just eat the whole chocolate bar one time and done, as opposed to spreading it out across hours.
Alright. Now, from my medical background, I know that the teeth, well, the outside part is the crown or the enamel aspect. It's the hardest substance in the body, right? And so what would be like the general principle why the bacteria and the acid able to damage such a tough structure? What about the structure of the enamel which would cause it to damage it, and why, I don't want to jump the gun, but why like toothpaste or Listerine would help balance and prevent that process?
Okay, so basically the enamel is made up of crystals called hydroxyapatite. And they have different minerals in hydroxyapatite as well, including calcium and other stuff. It's a very strong body. It's similar crystals to what you find in bones, but they're more densely packed. Acid is able to attack that because the acid might attack some of the different molecules in hydroxyapatite, and toothpaste is able to help because the active ingredient in toothpaste is fluoride. So instead of having hydroxyapatite, you get fluorohydroxyapatite. So the fluoride binds to the hydroxyapatite. Now that's a big word, so let's talk about enamel crystals. So the fluoride binds to the enamel crystal and make it more resistant to acid. So whereas a tooth wasn't exposed to toothpaste before, no type of fluoride or equivalent fluoride substitute, if you get attacked by acid, that half an hour period might be enough to get decay. But the exposure to fluoride through your salt, because in Jamaica we have fluoridated salt, which is a public health intervention. In some communities in rural Jamaica, they have fluoridated water. And not so much in the city though, but more in the countryside. And in Kingston, a lot of people use toothpaste. So with exposure to toothpaste, you have a lot more resilience to the acid attack. So you're able to probably hold up for hours as opposed to minutes with or without fluoride.
Alright, so we have spoken a lot about the cavities, but I want to move into now the prevention of cavities. Can we prevent cavities?
There are different ways we could prevent cavities. First, again, we come back to hygiene. A lot of times we get a toothbrush as a kid, but no one actually shows us how to brush properly. So there's a technique to brushing. I have to tell patients, if we have time, we can probably demonstrate a little bit today. But even without a demonstration, it just Google or YouTube
Yeah.
how to brush properly is a technique to it.
Okay.
Flossing also helps to prevent cavities from between the teeth, making sure you attack all the 5 surfaces that are above the gum line to prevent decay. That's the simplest way, but brushing and flossing alone is not enough to prevent decay. The next thing you need to do is to watch your diet. So like we were talking about before, in today's world with the amount of processed foods that we consume, it's almost impossible to avoid sugar, to avoid sweets, etc. So grouping things together, avoid snacking throughout the day and have meals that pair with snacks. So use the snack as a reward to finishing a meal or something, as opposed to eating it hours or stuff between meals. That will help also. And staying hydrated. A lot of times persons are dehydrated, so they don't produce enough saliva to combat the acid, making them more prone to decay. That's why we see, for example, patients who go through cancer treatment and stuff, it damages their salivary glands and they end up with a lot of cavities after chemotherapy or radiotherapy. So saliva plays a very major role. Even as a doctor, some of your patients who may be on hypertensive or diabetic medication, they may suffer from dry mouth, and then after being placed on the medication, they may end up with more cavities. So in those patients, we may recommend like chewing sugar-free gum, not Wrigley's or Juicy Fruit, but Trident, Orbit, 5, those type of gums can help to stimulate the salivary glands to produce more saliva to help.
Alright, and what about apart from the poor hygiene? Well, I mean, poor hygiene cover a lot of stuff, but like persons that smoke as well and probably drink a lot, those affect the teeth, so can weaken them for cavities to develop?
Yes, but in a different way. So both smoking and alcohol, they damage the salivary glands. So those persons will be in the category of people who have less saliva. So with this saliva, plaque sticks on to the teeth a lot more, and it's harder to, with regular hygiene, brush off all the plaque. So they'll be at more risk for decay because of that and because of the dry mouth.
Alright.
There are other things the dentist can do too to help prevent with cavities.
Alright. No, so we can probably move over into management of cavities. Alright, so you just want to give us an introduction of how we manage cavities in general. I know it depends on the severity, but in general, how do we do treatment for cavities? It probably depends on the severity.
I'm going to go through the different categories. So,
alright, give us the categories first.
So remember when we said early on that the first sign might be frosty white on the teeth?
Yes.
Those cavities are actually reversible. So a lot of people don't believe it and think that we fill everything. But some cavities at the very early stage are reversible. So if we see them on the x-ray or we see the frosty white surfaces, we might recommend medical grade fluoride treatments, which you'll get at your dentist. And those actually over time help to reverse those cavities. So that's the treatment for those. Now, remember I was talking about the dark lines on the back teeth?
Yes.
So if you have a very early cavity like a stain not going through the enamel, or you seem to have very deep grooves, as dentists we could place something called a sealant. So we basically put plastic-like material in the grooves so they're not as deep anymore, so food and acid can't penetrate in those areas, and it's a very good preventive way to reduce your risk of having deeper cavities. Now, when that dark or brown stain goes deeper down, that's where we start to do fillings to prevent the cavities from reaching the pulp or the nerve, as most persons will call it. But when you reach the nerve, that's where you start feeling pain or discomfort, and then your options may turn into either a root canal or an extraction.
So filling, I want to touch on the point of filling, because actually I was filling and it was so uncomfortable when I did it. I even refused to do the others, right? So is it a case where when you do a filling, like the teeth get so sensitive and it feel like when I was like throwing initially my teeth not fitting properly? What's the issue with filling? How can filling be comfortable for someone, or it just naturally have to be uncomfortable initially?
No, it's not an uncomfortable thing at all. Again, it depends on the severity of the cavities. Small cavities are very easy to manage, and it's more likely that you will have a filling that has a higher success rate, that is more comfortable in the long term. Sometimes when those cavities get deeper and approach the pulp, then you may experience sensitivity, because people don't think about it that way, but a tooth is a body part, and when we do a filling, we have to cut into the tooth to remove the decayed portion. So we're literally doing surgery on the tooth.
Okay.
Sometimes some people, when they do surgery, the surgical signs may be a little sensitive, especially if it's closer to a vital structure like a nerve. So it's similar to teeth. So if it's closer to a vital structure, but sometimes when you're numb and at the end of a filling, the dentist may check your bite. You may not necessarily bite the same way that you would bite when you're not anesthetized or numbed. So it may require an adjustment to have the teeth feel realigned.
Okay. And when we do like the root canal stuff that I spoke about in comparison to extraction?
Well, a lot of times it comes down to whether the tooth is restorable. That's the term that we use. Can we build it up to be functional again? Is it broken down so much to the point where anything we build on it will break off? That's one of the things that we'll say, okay, no root canal or extraction. But another factor is cost. Root canals are significantly more costly than extraction.
Okay.
So for a lot of the population, they may have to opt for extraction due to the cost.
Okay, alright. So what are, and I can probably move, since it's just a general public, what are some of the complications of cavities why we need to prevent them in the first place?
I'm going to go into a bit of research here, but we don't necessarily have the exact numbers for Jamaica, but in the US, dental cavities, then tooth decay, is the #1 reason why kids miss school, right? It causes pain, it causes discomfort, and a lot of kids, I worked in the inner city for a long time, and we see a lot of kids with a lot of teeth that are badly decayed, and they go through a lot of stress, pain, unable to chew, and malnutrition because they're unable to chew. Some other effects would be infection, persistent infection, face can be swollen because of a tooth, and in very severe cases, you can have cavernous sinus thrombosis, which is a very severe complication in the brain where the infection could spread so far, it could go to your brain cavity, and it can even spread to your heart and cause infection in your chest cavity as well.
Alright, and then in general, like some persons with, I know that cavities are one of the reasons for bad breath, because sometimes I have patients come to me and sometimes they complain about bad breath, and I see cavity in their mouth. I know that we just have to send them to the dentist because we're unlikely to solve their problem. Alright?
Yeah.
That's another complication.
Yeah, bad breath.
Alright? Alright, but any final, if you want to summarize about dental caries and cavities, I can go ahead and I'll give you some time to just advertise the business Majestic Smiles. Alright? Sure.
Even though cavities are up there, but one of the most common diseases in the world, is also one of the most preventable diseases in the world. As with a lot of conditions, of course. So it's really something that we should think about in terms of preventing. A lot of times we end up with decay because of the circumstances we grew up in. Our parents didn't know better, but with access to information today, tooth decay is not something we should be overwhelmed with. It shouldn't be as heavy a burden that it is now. So with decay, it's always good to have a dental home, a dentist that you could go to. There are many great dentists in Kingston, Jamaica. I would love if you could come to Majestic Smiles.
Yes, definitely come to Majestic Smiles.
We're very serious about smiles, but it's important that you find a dentist wherever you are. Have them take x-rays just to know what's happening, so we could take a more proactive approach versus a reactionary approach. When we're proactive, we could save a lot more teeth, because teeth are important. You may see a lot of older people lose weight, are malnourished, and a lot of times it's because they don't have teeth to chew.
Oh.
We don't think about it like that, but teeth are very, very important. Teeth help with your confidence, and that's another effect of dental caries, tooth decay, because if your front teeth are decayed, they start to compromise your aesthetics, your look. So we really don't want people to lose confidence because of something that's so preventable. And so watch your diet too. Put all the food and all the sweets together and reduce the snacking throughout the day.
Okay. Alright. Dr. Barras, well said. Alright, now I'm just going to give you a chance to advertise and talk a lot about Majestic Smile Dental and the services that they offer here. Alright, so come and check her out. That's why my smile is so majestic. That's what I put on the form the other day. Alright, go ahead. Tell them about the stuff that they offer.
So Majestic Smiles Dental, we've been around for about 4 years. Initially, we had our first office in the 3 Mile area, and now we're also in Grandspen. We'll be exclusively at Grandspen starting in July, and we offer the full range of dental services, general dentistry, including the fillings like we just talked about, but cleanings, extractions, root canals, crowns, bridges, veneers. We do Invisalign, so we can help you to achieve straighter teeth. We do dental implants, so we can help you replace missing teeth. And also coming soon will be Botox and fillers and other.
Okay, so you're just tell them the contact information,
okay,
and the exact address of this business.
So we could be found online if you Google or search on Instagram, Majestic Smiles JA. You can call us at our phone number 876-221-0218 or 876-425-2909. We're located at Shop 8 Global Plaza, 62 Grandspen Road, Kingston 8. It's right off Constant Spring Road, right next to the plaza in the gully. The plaza right beside the gully, that's where we are. And we're serious about smiles, and we're serious about you too. So don't hesitate.
Okay, Dr. Barras, well said. Alright, so remember guys, really come and check out Majestic Smiles Dental. And they're serious about smiles, right? And also remember to help build this channel. Kindly share, like, subscribe, and leave a comment on this video. And if you want to ask any question about cavities, you can feel free to put it in the comment section, and I will kindly have Dr. Barras to respond to those questions accordingly. All right? Yeah. And so until next episode, take care.
Bye.
Be sure to subscribe for more informative contents on life, sickness, and death.